Well, April marks National Autism Awareness Month, a time for us to promote acceptance and support for those on the spectrum.
Yeah, and here to debunk some of the common myths surrounding autism is Dr. Amy Sickel from Kansas City University. Dr. Sickel, good to see you again. Welcome back.
Good morning.
Good to be back.
The number of children diagnosed with autism continues to grow. Is that because we know more about autism or because of something else?
Well, we are seeing more people getting diagnosed and seeking treatment. And I think that is the primary reason, because it's okay to ask questions and begin to get answers.
Yeah, this also goes for girls. Why so with girls?
So with girls, we have seen 4 boys to every 1 girl are diagnosed with autism, but in the most recent years, that gap is closing 2 to 1. And so there's increased understanding in how it can present differently in girls, and girls aren't typically getting diagnosed then later until about age 8.
Oh, wow.
I would think that new parents, first-time parents, if they feel like something is not right, you know, everything goes through their mind all at once, and it can just be, what should parents do if they suspect something like this?
Ask questions early. So children with autism can be diagnosed as young as age 2, and wait lists can be 3 months, 6 months, and in some areas up to a year. So if parents have concerns, it is getting on a wait list. The sooner the better. Ask your pediatrician, educate yourself about milestones, and be okay to ask questions.
Yeah, we were just talking about that in the break, and also of the term Asperger's. A lot of people are confused about what that means and the differences. Are you able to just kind of break that down?
Yeah, in 2013, the psychological and medical community moved away from the term Asperger's, and it's now all autism with different levels of severity.
Oh, okay.
And so that's determined on how much support is needed. And so there's this recognition that it is all the same presenting symptoms, just different levels of severity that need more support.
Gotcha. Okay.
And talk to us a little bit more about milestones, and maybe talk to some parents out there that are watching, and maybe their child has recently been diagnosed. I know as a parent, when I would visit, sometimes you just get caught up on milestones, and as a parent, you sort of, well, you tell me, but you sort of have to just let your child reach those milestones and not be so worried about that, right?
Yeah, well, and one key is that all kids are different, and so some
Yes.
kids might progress at different rates, but if you look at the way children with autism play, many times it is they are playing a storyline by themselves versus having a storyline interact and respond to someone else's. Children with autism also have many repetitive behaviors where they're doing certain motions or sounds over and over, but the key is it causing a problem in a relationship or being able to get daily things done? So just because I do a few repetitive behaviors doesn't equal autism. It is it to the point where it's causing a problem? And that's where evaluations come in, because evaluations then compare how my kiddo is doing to the rates other kiddos are doing, so we can say yes or no.
Yeah, and just real quickly, you were telling me also things can get better, depending on the child, correct?
Yeah, so treatment is key. The more we know, the more we understand, then we can get better because the world around us understands.
Yeah, and early detection, and I mean, you're learning more about autism every day, and whether it's through fine motor skills or through other types of techniques, can really help a child get back on track and lead a very great, successful, full life.
Absolutely.
Yeah.
And resources like infoaboutkids.org and also Autism Speaks are great ways to learn what to expect from your kiddo and then also how to get help in your local community.
Yeah.
All right. That's great. Additional information for those parents.
Yes.
All right.
Dr. Sickel, it's great to see you
Good to
again.
see you.
Good to be back.
A lot of parents out there worried when something like this happens. So there's solutions, that's for sure. Great to see you.
Good
Thank
to be
you.
here.